Oh my God. Dr. Mahmoud, can you see me?
Yes, I can. Can you hear me
Hi.
well?
Yes, I can see you. How are you?
I'm good, thank you.
Thank you so much for joining me on Instagram Live today. We have a lot of audiences who are extremely interested in our topic today. Since the vitiligo camouflage tattoo have been just such a difficult, technique, a service to provide for a
Mhm.
lot of medical tattoo artists. So I really appreciate your
Sure,
time.
happy to be here.
Yeah, I barely do. Can you hear me?
Yes, I can.
Oh, okay. So, my followers, thank you so much for joining our live today. I barely do go on live, as you guys know. So this is a really special invitation, a special guest for you and Dr. Mahmoud as well. So, so today, during this 30 minutes live, Dr. Mahmoud, I really wanted to, I think this is probably the most frequently asked question from my patients and as well as people who may be interested in getting the service done in the future, or also from paramedical tattoo artists. The first question is physician's point of view on the use of micropigmentation for vitiligo.
Sure. So thank you for having me today.
Mhm.
And I would like to thank also Renee Gao, one of our amazing medical students who organized this session. So let me give like a quick overview of vitiligo as long as we started a little bit early.
Mhm.
So vitiligo is a chronic skin condition. It's loss of pigmentation. And this introduction will help people to understand how medical tattooing works. So it occurs because the melanocyte itself, which are the cells that produce the melanin, which is the pigment that gives skin color, are destroyed. And it appears in the form of white patches on the skin, right? So when this happens, usually the patches are symmetric most of the time on both sides of the body. It can affect even the mucous membrane, which is very important when we're going to talk about medical tattooing. So it can affect the inside of the mouth as well as the inside of the nose as well.
Mhm.
Also, it can affect the hair. So the hair turns white, the hair of the scalp, the hair of the eyelashes, the eyebrows. The good thing about vitiligo that it doesn't have any pain or itchy symptoms. So it's only a discoloration of the skin,
Mhm.
right?
Mhm.
But at the same time, it has a huge psychological impact on patients or on people in general, right? Now,
Absolutely. Yeah.
the cause for
Mhm.
vitiligo is there are many theories. There is no exact cause. The main one is autoimmune therapy or autoimmune reaction, which means that there are antibodies in the skin
Mhm.
that attack the cell that produce the pigment and then destroy them. And this is how vitiligo happens. There are other minor theories like genetic predisposition, like hereditary. It runs in family, environmental, like sunburn, skin trauma, which again is important when we talk about the indication for medical tattooing. And there's also a neurogenic factor that can play a role. Again,
Absolutely. Mhm.
most of the vitiligo are non-segmental, so it can happen on both sides of the body, but there are a type which is less common. It's called segmental vitiligo. And this is important when we talk about the surgical modality for treatment of vitiligo later on. And this type of vitiligo specifically happens on one side of the body. It starts and then it progresses over a month or year and then becomes stable after that, unlike the non-segmental or generalized vitiligo, which can reactivate at any time. And this is important when you choose or select your patient for medical tattoo. Now,
Absolutely.
now
Mm-hmm.
regarding treatment option, the mainstay for treatment for a long time was topical steroids, which people used to use for years and years. The problem with topical steroid that there is a main side effects of topical steroid. It can thin out your skin. So it can cause what we call skin atrophy. So when you apply it, especially on the head and neck area or on the genitals, it can thin out your skin. And this is a huge side effect. And that's why many other products came into the market recently,
Mm-hmm.
like we call them immunomodulator, like tacrolimus, pimecrolimus, which is Eridel. which you can apply on the head and neck area, but does not cause this side effects, which is the thinning of the skin. And finally, very recently, 1 year ago, the first FDA approved medication for vitiligo was out in the market. It's called roxetinol cream. And this is the first FDA approved cream to treat vitiligo. Now, other options are phototherapy like ultraviolet, systemic treatment like systemic steroid, surgical treatment, which we're going to talk about in details. And then there is the medical tattooing and cosmetic cover up, which again, we're going to talk about in details. There is one more variety, which is depigmentation, which means if a patient has vitiligo more than 90% of the surface area, it doesn't make sense to treat these 90%. So what happened is we actually advise the patient to depigment the remaining 10%. And then the patient like regain color of not his regular color, but the whitish color. And then it appears homogeneous all over his body. There is also a very important thing, which is the psychological impact. So we created in many different states across the country vitiligo support groups so that we can help those patients with the psychological impact that vitiligo has.
Got it. So, in your opinion, Dr. Mahmoud, what are the success rate in these different types of treatment?
So it depends. So that's why a consultation with a dermatologist is very important because you
Mm-hmm.
need to understand each patient is different. Like we treat like it's more like customized. So it depends on the age of the patient. It depends how long the vitiligo has been there. It depends on the location. It depends on the activity, on the stability of the disease.
Mm-hmm.
It depends what previous treatment the patient was on, and if there is any other associated thing that the patient has that may have an effect on the treatment,
Got
right?
it.
Now,
Mm-hmm.
going back to your question, which is the micropigmentation or medical tattoo, I think it's a very important, one of the many important treatment for vitiligo for patients who do not uh, develop any success with the other modality.
Got it.
So it's exactly like the surgical treatment, like that the one I'm doing, which is MKTP. So basically, the patient usually start by the topical treatment, the
Mm-hmm.
ultraviolet therapy. These are the mainstay of treatment for vitiligo at the beginning. And it's important uh, specifically to stabilize the disease. Because one of the indication of surgery or medical tattooing, like the one that you're doing, for instance,
Mm-hmm.
is that to make sure that the patient is stable. And when we talk about the pros and cons of medical tattooing, I'll explain more like why this is important to have stability of the disease
Yes.
before going on and doing the tattooing or the surgical treatment, which can
Mm-hmm.
go hand in hand. So I believe your role as a professional medical tattooing is very complementary to our role as physician in treating patients with vitiligo. So basically, medical tattooing is that it's an option for some people to help improve the appearance of the depigmented areas. As I mentioned, there are pros and cons. So it's important to consult the dermatologist. And in tattooing, typically, as you know, of course, that you match the pigment to the patient's skin, right?
Absolutely. Right.
That's a very important step. And that's the difference between a medical tattoo artist like yourself
Mm-hmm.
and a standard or a general tattoo artist who doesn't know about this step. Because with vitiligo, it's important to match exactly the patient's skin tone and not just draw a picture with colors. See what I mean?
Absolutely.
So you want
Yeah.
to make sure that you reduce the contrast between the pigmented and the depigmented area as much as possible.
Mm-hmm.
Now, what's the advantage of medical tattooing for vitiligo? First, it improves the appearance because you can blend the depigmented area with the tattoo, with the surrounding skin, right? So it
Right.
becomes less noticeable. And less noticeable is important because I have patients, as I mentioned, tattoo, I mean, vitiligo can be a very devastating disease psychologically. I have patients, for instance, who came to me and they like, and because there is no much knowledge about vitiligo, and that's why I started about talking about vitiligo in general, because people think it's a contagious disease, like it can infect you. So I have patients coming and they are complaining that their friends now they don't shake their hands, that they cannot get married before vitiligo.
Mm-hmm.
It's very psychologically devastating. So it's important to also spread the knowledge about the disease itself, that it's not a contagious disease. And that's why medical tattooing is important, because it can hide this from patients and can help them improve their quality of life. Now,
Absolutely.
the other advantage, it's long lasting. So when we talk about cosmetic cover up or camouflage cover up, the medical tattooing is more long lasting. It stays for years. And I also have patients coming and saying that they do the camouflage cover up every single day. And they say that because they have to go to work at 7 a.m. in the morning, they wake up at 4 a.m. every single day to be able to do the cosmetic cover up, which is a huge burden. But if you do the medical tattooing, then you don't have to do that every single day, right?
Right.
The third pros is that it's customized to the patient. So every patient with different skin color, with different traits, like white or from Latino origins, or black or Asian, like all these, you can customize the blending of the color with the skin, and it can last for a long time. So that's the main advantage of doing medical tattoo.
Okay. So I have some questions, Dr. Mahmoud, if I
Mhm.
may ask. So you had mentioned that the patients can start using a topical cream and do the photo light therapy
Mhm.
prior to making a decision to do paramedical tattooing. In that case, how long is a good time to give it a try with the phototherapy and topical cream?
That's a very good question. So, in general, and there are two components to this question. So, there are the time to use the medical therapy
Mm-hmm.
and how long from the vitiligo itself to become stable before you're able to do that. And I'll explain why in a minute. So, in general, we ask the patient to start doing medical therapy. If there is no improvement after continuously using ultraviolet, for instance, or medical treatment for at least 3 months, then possibly the patient is not going to improve on this modality of treatment. The other thing that sometimes can point out, like a clinical symptom that you can see on patient and can point out that this patient is not responding, when you start seeing white hair. We call it leukotrichia. Leuko is white and trichia is hair, right?
Mm-hmm.
So when you start seeing white hair in the middle of a vitiligo patch, possibly this vitiligo patch is not going to respond to various modalities of treatment. And the reason why is this hair has the store of melanin in the hair follicle underneath. So
Mm-hmm.
if the storage is present in the hair follicle or adnexal structure of the skin, then when you apply the treatment, whether it's topical or ultraviolet, you're going to stimulate the melanocytes in the hair follicle.
Mm-hmm.
So they are absent from the skin surface, right? But underneath in the hair follicle, these melanocytes are present. So with the treatment, they can start to generate pigment, and these pigments are going to appear on the skin. But if you don't have this reservoir, we call it a reservoir of melanocytes. If this reservoir is absent, which means that you see white hair in the middle, then possibly clinically, this vitiligo is not going to respond to the medical treatment or ultraviolet treatment. So that's a clinical side. Now, the second component to your question, like when can the patient get surgery, like MKTP or medical tattooing? As for surgery, and I know for sure, like for medical tattooing, you also guys have your guidelines, but for surgery specifically, we request that the patient be stable for at least 1 year before proceeding to surgery. And the reason why is there is something called Kepler phenomenon. So what's Kepler phenomenon? Kepler phenomena mean that if you get any trauma on the skin, if the patient is exposed to any trauma of the skin,
Mm-hmm.
what happens is on this particular area where you get the trauma, the skin is gonna produce the exact same pathology that the patient already has on other body sites, like vitiligo. So let's say you have an active vitiligo and then you do tattooing or surgery.
Mm-hmm.
Let's say the vitiligo is on the face and it's active, right?
Right.
And then you do tattooing on the neck.
Yeah.
On the tattoo area, the patient is going to develop vitiligo. This is this is called Kepler phenomena, and it happens when the vitiligo is still active. So it's going to be a waste of your time, of the patient money and time, and then the vitiligo is going to get worse because it's going
Absolutely.
to appear in a new area
Mm-hmm.
where he had the tattoo, and that's why stability is one of the key components for vitiligo before it can be treated. Because medical tattooing is a procedure, right? It's considered surgery too, because you're introducing needles inside the skin.
Right.
So that's almost the same as a surgical
Okay.
procedure. And
Yeah.
actually, when we divide the treatment modality for tattooing, I
Mhm.
mean for vitiligo, the three component is either tissue grafting, cellular grafting, and the third modality is tattooing. So that's considered a surgical modality for treatment of vitiligo too. And so the rules that apply to surgery should apply also to medical tattooing as well.
Okay. So another question for you, Dr. Mahmoud, is that you had mentioned that it's the vitiligo has to be stable for a year. So just to for the education purpose for my audience, the stable means that vitiligo hasn't been spreading for a year, right?
So by definition, the stability of vitiligo means that the patient does not develop any new lesions of vitiligo in any other body sites or an enlarging a pre-existing vitiligo area. So let's say the patient already has a patch on his cheek,
Mm-hmm.
right cheek, for instance, right?
Yes.
And this patch become bigger. That's activity.
Mm,
Although it's the same patch, like it's the same area, right?
right.
But it becomes bigger. That means that the vitiligo is still active.
Still active.
Or if he develops another patch in a different area or next to it, again, that's instability. And that's why one of the things that we always advise patients, and we do it as physician, is
Mm-hmm.
whenever the patient comes in, we always take photos. Because if you see the patient after 6 months, they may not remember. Like they will say, oh, I had this patch. I'm not sure if it's growing or not. I'm not sure if I had one next to it. So we always take photos of the patient of
Mm-hmm.
all the areas of vitiligo, and we do it with the regular light and with woods light. Because sometimes if the patient has fair skin, like very fair skin, the contrast between the vitiligo and his skin may not be very obvious. So what we do, we use what we call woods light. It's like a black light. And this, like, you know, the light that they use in nightclubs, like,
Yeah.
uh, exactly. So this light can actually make the contrast between the vitiligo skin and normal skin more obvious. And then we take picture with that as well. And then when we see the patient for the next visit, we can compare between the two pictures, and then we can say for sure if this patient is stable or not. I just finished one study with a new device on vitiligo,
Mm-hmm.
and one of the key features of this study is to make sure that the patient is stable. And the way to do it is looking at the medical record of the patient and looking at pictures and comparing them now and before to make sure that he's actually stable and not just subjectively stable. Because some patients, they come and they want to get the procedure done. So when you ask them, and they know that they need to be stable. So when you ask them and you say, is this vitiligo stable? Because they want to get the procedure done, so they wish it's stable, so they just say it. But when you compare the photos, it's not. And if you do the procedure, again, you're going to actually harm the patient more than you're going to benefit the patient.
Got you. So I was kind of running in my mind. So in my studio, when vitiligo clients come, I refer them
Mhm.
back to their dermatologist to make sure that doctors can determine that if they are eligible to come and get the camouflage tattooing
Mhm.
done. If the clients, and just to kind of summarize, treatment plan for camouflage tattoo artists who are in live today, so they can kind of have a plan set for the future clients.
Mhm.
If there's a new client coming, you're recommending to send them to do other treatments first, and then when the vitiligos are stable, at least for a year, then they can come and do the camouflage tattoo. And then in this process, that their dermatologist can decide if it hasn't been spreading, it's been stable.
Correct,
Correct?
correct. So
Okay.
it's more like a consult. So you send the patient, they have a consult with the dermatologist, they discuss all previous treatment
Mm-hmm.
and all ongoing treatment. They assess how the vitiligo is progressing or not. And also we have to take in consideration that vitiligo can be associated with other diseases too. And the
Oh my
patient needs
goodness.
to
Yes.
understand that. So
Mm-hmm.
because vitiligo is an autoimmune disease, some of the associated diseases that can happen with vitiligo is diabetes mellitus, autoimmune thyroid disease. So there are alopecia areata, which is loss of hair. So we have to take all that in consideration. So the medical consult is important first to rule out any, because sometimes we order some thyroid tests, for instance. So
I
it's
understand.
very important to know what the extent of the disease is, if there
Mm-hmm.
is any other medical association with the disease, make sure that the patient is active or not, that he tried other treatment, because if the patient is active, if you actually treat the patient very early with medication that suppress the immune system, you can clear the patient completely. But if the patient wait till it becomes stable and was not treated at the beginning, then it's very hard to treat at that time. And then you have to do surgery or medical tattoo.
I understand. Another question from some patients I have is about the sun exposure on vitiligo
Mhm.
spots. What does it happen when vitiligo patients, they exposed to the sun?
So there are two components to that. So there is the component that you have loss of pigment, right? And the
Mm-hmm.
pigment, the reason why people have pigment is to protect them from sunburn, right? That's the main
Right.
thing. Like the pigment of the skin act as a sunblock, correct? So
Yes.
someone who has dark, and we divide in dermatology, we divide patient into skin types, right?
Mm-hmm.
So skin type 1 to 6. So 1 is the very fur, doesn't burn, and then 6, I mean, burn easily, and then 6 is the one that doesn't burn at all, right? Like very dark skin. So if someone has vitiligo, it's considered type 1, even if his type 6, because the vitiligo patch is a milky white patch, right? So if he's exposed to the sun, he can easily burn because he doesn't have any protection. So people with vitiligo, we always advise them to use sunblock and protect their vitiligo area from the sun. Now, there is another component to the question is skin cancer. Because,
Mm-hmm.
I mean, people know that people who have fair skin are more liable to develop skin cancer.
Yeah.
But in vitiligo, on the other hand, there is some kind of immune system for vitiligo patients that protect them from skin cancer. So actually, skin cancer, melanoma and non-melanoma skin cancer in vitiligo areas are less common than in normal skin.
Oh, wow.
But, yep,
It's amazing.
but they can sunburn. So they have to be careful with the sunburn, especially if it's on the face,
Mm-hmm.
it becomes really red. And going back, remember when we talked about Kevner phenomena, which when you have a physical trauma, actually a trauma like sunburn can induce vitiligo. So this is one of the Kevner phenomena too. If a patient has active vitiligo, right,
Yes.
and then he goes in the sun and then he gets a sunburn, an area that's normal may develop vitiligo because of the sunburn, because it's considered as a trauma to the skin. Because
Mm-hmm.
trauma can be anything, can be like a physical trauma, a direct trauma from a knife, a trauma from a chemical burn, any of that, like even if he has like a burn in the kitchen, like the patient is cooking, right? And then he has a burn in the kitchen. This is considered a trauma, and then he can get she or he can develop vitiligo over this trauma. So sun exposure specifically can cause that in patients with active vitiligo too.
Got it. Oh, wow. So many amazing information and education you're giving us today. Thank you so much.
Thank you.
Some of the answer that hasn't been a little bit unclear for me was definitely answered from this question. Thank you. So we briefly discussed about available treatment for vitiligo patients. So I am aware that you are a specialist, one of the few specialists in MKTP surgery. Could you tell us a little bit about what it is?
Sure.
Mhm.
So MKTP stands for melanocyte keratinocyte transplantation procedure. So melanocyte and keratinocytes are the cells that are in the epidermis, because the skin is formed of epidermis, dermis, and then subcutaneous fat or tissue, right? So the epidermis is the layer that has all the cells that produce the pigment, which are the melanocyte and the keratinocyte, which is just next to it, right?
Mhm.
So this is an advanced surgical technique. It's present in very few centers in the United States. And the idea, it's a cell transplant, which means that we transplant cells and not actual tissue. And the reason why we're doing that, because previously, many years ago, people used to do tissue grafting. And tissue grafting is a very easy procedure, and I can explain to you like in a minute how easy it is, and any dermatologist can actually do it. So An example of tissue grafting is punch grafting. For instance, a punch is like a pen that has a hollow end. It's like if you go to a dermatologist and he does like a skin biopsy, usually use a punch, right? So this punch is like exactly like a pen with a hollow end at the end, and then you
Mm-hmm.
puncture the skin. So you take a small piece of skin, like 1 to 2 millimeter. So this is a punch, we call it punch grafting. So the idea is you take punches 1 to 2 millimeter from normal skin, and then you put them in a dish, and then at the same time you take same size or a little bit smaller punches from vitiligo area, right? So you have the same number of holes in the vitiligo and from normal skin. And then you take the punches and then you put them in the holes that you created in the vitiligo skin, right? And
Mm-hmm.
then up on like with regular interval between each punch, right? So after a few weeks, these punches start to spread the pigment and then the color come back in this area. So it's a very easy
Oh,
technique, right? But
wow.
it's an easy, but
That's
here's the
fascinating.
thing. It is
Mm-hmm.
fascinating. So it's called tissue grafting or punch grafting. Now, the pros that it's easy, but the cons is that when this heals, because you took punch grafting, it leaves what we call cobblestoning on the skin. You know the cobblestone? You know, like when you walk in the street of Paris and then you see these cobblestones in the old streets.
Mm-hmm.
So it looks like that. So the skin, instead of being nice and flat, yes, it's pigmented, but it's cobblestone. It's bumpy,
Got it.
which is cosmetically unacceptable. Like imagine you have this on your face, on the cheek or on the nose, and then you have all these bumpiness that you
Yeah,
create. Actually, it's much easier to hide vitiligo with cover up makeup than to
mm-hmm.
hide the cobblestoning, because the cobblestoning is like bumps.
Texture.
So if you
Right.
try to hide it, it may even look a little bit abnormal, even, right?
Mm-hmm.
So that's the tissue graft. The second tissue grafting, which is again an easy technique, is to take a graft from the skin, like a piece of skin, and then you suture it on the vitiligo area. So again, that's tissue grafting. Now, tissue grafting, it's it's better than punch grafting because it doesn't leave the cobblestoning.
Mm-hmm.
But the disadvantage that you can only do 1 to 1 ratio from donor to recipient. So let's say you have a 10 square centimeter of vitiligo, and then you do a tissue grafting, a tissue grafting from normal skin. You have to take a 10 square centimeter normal skin to apply it on 10 square centimeter of vitiligo. So because the ratio is 1 to 1, it limits the procedure to a very small surface area. So the cell, now let's go to the cell transplant, the technique that I'm doing now, which is the new technique. So the idea of the cell transplant that you take the tissue graft, but
Mm-hmm.
the size that you take is up to 1 to 20, the size of vitiligo. So let's say you have 100 square centimeter of vitiligo, you take 20 times less the size of a graft from the skin. So
Mm-hmm.
it's so it makes you like treat a huge surface area instead of doing 1 to 1. So that's the main advantage of the cellular graft. So basically what you do is you take a very tiny piece of skin, again 1 to 20
Mm-hmm.
from the donor to recipient side. I usually take it from a hidden area like the upper thigh or the bottom. So it's a very hidden area in the body. And then I send it to the lab, which is the same hallway.
Mm-hmm.
What the lab done is that it separates the epidermis from the dermis. Remember when we talked that the melanocytes are in the epidermis? So what we need is the cells, right? So we separate the epidermis from the dermis with a certain enzymes. And then we take these cells and then we suspend it in a solution. So the cells, the melanocytes itself that produce the pigment are suspended in a solution.
Mm-hmm.
And while doing that, I do a laser resurfacing for the patient. And the reason why I do that is to make the vitiligo area able to uptake the cells. Because if we apply those cells or normal skin of vitiligo, these cells are going to leak. It's like a solution, right? It's as if you
Yeah.
put water on your skin. So it's not going to take. So in order for these cells to be uptaken by the vitiligo area, we have to sand the skin, like sandpaper. So
Yeah.
instead of using a sandpaper, we use like a little bit of high-tech technique, which is the laser resurfacing. It's either a CO2 laser or an erbium YAG laser. So we remove the top part of the skin, just the top part, as if you have like a minor abrasion of the skin. And all this is done under local numbing, local anesthesia. It's not general anesthesia. And then once this step is done, then we have the cells ready we apply them on the vitiligo area, and then we put a special type of dressing with collagen dressing, and then we keep it in place for 1 week. And then the patients come back after 1 week, we remove the dressing, and then the pigment usually start to appear after maybe 6 to 8 weeks from the procedure. So the pigments start usually faint and then start to gain color of the normal skin after about 4 to 6 weeks from the procedure. And it can keep going on up to 1 year from the procedure. And there was a study that was done looking at long-term effect of retaining pigment in this particular procedure. And it was found that after 6 years from the procedure, more than 50% of the pigment are still retained by this procedure. And that's also one of the difference, because there is also like a cons for medical tattooing that we have to talk about, is the retain of pigment.
Yeah.
That's a very important thing that lots of patients are concerned about. Because what happens is when you do tattooing and then let's say you do it and then after a few sessions, because you have to do it multiple times to get the right color, right?
Yes.
And I'm sure you know that already. And I would love to hear your technique too, but in general, my understanding that you have to do it multiple times in order to be able to get the right color at the end. But then even after you do that, you see that some people after 1 to 2 years, they start losing the pigment, right? And then you have to do some touch-ups, correct? So why this happens, and that's important, and that's the difference between tattooing and MKTP in general. Because for MKTP, the pigments start to appear late, not like early as medical tattooing, but it stays for a longer time and it matches the skin. In medical tattooing, you need an expert. You need someone like you, like a professional tattoo artist who actually does like a great job in doing that. Not everyone can do that. But at the same time, even if you're like the perfect tattoo artist and you do exact same technique on two different people, let's say you have two brothers, they come at the same time, right?
Yeah.
And then you do tattoo for them with the exact same technique and with the same tattoo artist, with you, for instance, right? After 2 years, one of them may retain the pigment and one of them may start losing pigment, or the pigment may change in color, correct?
Correct.
Sometimes it's very unpredictable. And it can also depends on the race of the patient. It depends on location of the tattoo. It depends on many factors. The ink that's used, the type of ink that you use, where you deposit the ink in the skin. And that's why the technique itself is very important. So why this happens? So the reason why this happens is when you put the tattoo in the skin, in the dermis, it is captured by an immune cells called macrophages, right? Now, this is how the tattoo stays in the skin.
Right.
So the macrophages eat the tattoo pigment and then stays in the dermis for years. The lifespan of macrophages is years, right? Which means that the longevity of the tattoo depends on the immune system of the patient. So what happened then? After this macrophage die, they release the pigment, right? So what happened when they release the pigment in the skin? Two things. Either it gets washed by the lymphatics, and this is how you lose your tattoo. So that's exactly the technique of, or the mechanism of how the tattoo is lost. So the tattoo is in the dermis and captured by the macrophage. The macrophage die or for any reason lose, the pigment is washed by the lymphatics to the lymph nodes, right? And then get lost. Or it gets dropped deep in the skin. So either it's lost, which means that the color itself completely is lost, or when it drops deeper in the skin, what happens is a phenomena called Tyndall effect. So Tyndall effect is when you go deep in the skin, the color change from being brown to gray to blue. And the reason why, so the idea of Tyndall, you know, when you look at the sky, why the sky is blue? No, it's not blue. The sky is not blue actually. Why the sea is blue? The sea water is blue. It's not blue. What happened is the light, the visible light, when it gets in the sky, when it gets reflected, the shorter wavelengths are the blue wavelengths, because the visible light is from 400 to 700, right? So the shorter wavelengths is the blue, which is near the 400. The longer wavelengths is the red, which is toward the 700. So the shorter wavelengths get scattered. So when you look at the sky, the reflection or scattered light is blue. That's why you see the sky blue. And that's why you see the sea water blue. It's not because it's blue. If you actually hold the water in your hand, it's colorless. It's not blue, right?
Mm-hmm.
So what happened is when the color goes deep, the pigment goes deep in the skin,
Mm-hmm.
it appears grayish. And that's why by time, some of the tattoos that are brown initially look grayish later on because they
Yeah.
are dropped deep in the pigment, deep in the dermis. And then instead of looking brown, they look grayish. Now, going back to the immune system, if the macrophage died and there is no other macrophage to recapture, so we call it like a cycle of capture, release, and recapture. Because what happened when the tattoo is released, usually there is another macrophage. If your immune system is good, another macrophage comes and recapture the tattoo pigment, and then it stays. If this doesn't happen very soon,
Mm-hmm.
the tattoo pigment are washed off. So if someone has a bad immune system, like their immune system is not as good as the other person, and
Mm-hmm.
that's why it's different. Their immune system may not be strong enough to recapture the pigment and keep them in the skin. And then they get washed off easily. And that's how one person may get this exact same tattoo as the other one, but then they don't react the same. There are many other factors like smoking affect the blood flow. Location on the body, like some areas on the body have good blood flow, so they are actually good in maintaining and developing pigment, while others have low blood flow, and smoking can affect that as well. So there are many factors, but in general, the immune system plays a huge role in this particular matter.
Wow, this is incredible, Dr. Mahmoud. All of those questions that I had about vitiligo, you just answered everything because it does change after the color does fade into grayish, sometimes pinkish color after a year or two. And then sometimes, even though it's a one client who has vitiligo spots all over the body, I do find that some spots retain the color longer, whereas
Mhm.
the other spot just fades like within 6 months to a year. So, so as far as the macrophages, so the person's immune system, if they have a stronger immune system, it means that they have a higher activity of macrophages, correct?
It depends on the number and function. So
Number
there
and
is like
function.
exactly, yeah. So I mean, there are many factors that control that. That's why it's not just like a strong immune system, because a strong immune system can be bad. If you have like
Mm-hmm.
because for instance, vitiligo, you have a strong immune system against the melanocytes, right? So a
Right.
very strong immune system can cause what we call autoimmune diseases.
Mm-hmm.
So you need a normal immune system. You don't want it to be strong and you don't want it to be weak because both are bad, right? So you want something to be normal. That's the thing. But if someone has a weak immune system
Mm-hmm.
and the macrophages does not do their role, then he's going to lose the pigment fast.
Got you. Oh my God, this is incredible. So, um, what would be the possibility that vitiligo clients can take advantage of MKTP surgery as well as vitiligo? Is there any like specific spots in the body? Because I think while I was having a conversation with
Mhm.
Renee, your medical student, that um, I had a little bit of information about the body areas where MKTP is not quite successful as other body areas. What is your opinion on that?
Correct.
Mm-hmm.
And that's totally true. And this is where medical tattooing comes into play. So
Mm-hmm.
here is the thing. So most body sites respond well to MKTP except two main areas. We call it lips and tips. So
Let's
the mucous
yes.
membrane, so whenever you come closer to the vermilion border of the lips,
Mm-hmm.
like the red part of the lip, we call it the vermilion border, the red lips, or the tips of fingers and toes. Now, these areas do not respond to MKTP. So even like a patient comes and have lip or tips vitiligo, I 100% recommend against getting MKTP. And this is where actually the role of medical tattooing can come into play. I've seen some of your cases on the lips,
Yeah.
and you have like wonderful results.
Yeah,
And
thank you so
these,
much. Yeah, I find that around the lips are actually have been giving me pretty successful results. I'm really
Mhm.
happy to hear that.
So that's why I'm saying it's very complementary. What you're doing complement my work, because I can treat most body size, but specifically, even like I had patient before, and I can show you later on some photos, who has like segmental vitiligo on the neck, the chin, and the lip, and I treat the whole area, everything repigment except this part, and then the tips, the same thing. So I do the dorsum of the hand,
Mhm.
and then when I start going toward the tips of the finger, they do not repigment. That's why I don't even do them anymore. And again, medical tattooing can have wonderful effect on these. So for instance, could be like some kind of like collaboration, like someone has an area on the chin, so he can get MKTP on the chin and then medical tattooing close to the lip margin.
Okay, so I'm getting some comments from the our audience. I know, Dr. Mahmoud, you are also a specialist, and you have a high interest in tattoo removal services, correct?
That's true.
Yeah.
So I do laser tattoo removal, correct?
Okay. So, as much as our, tattoos have become really popular, recent years, numbers of people who also want to remove the tattoos have
Mhm.
increased. Um, what could we have some your opinion about IPL tattoo removal?
Okay. So there are many actually modality for tattoo removal, but the
Mm-hmm.
main one that works with minimum side effects is laser. So I always advise patients, because there are some creams in the market, there are some stuff that people use. I don't recommend them at all. They can burn your skin, they can cause scarring. So please don't do that. So
No IPL.
the
Mm-hmm.
best treatment for tattoo removal is by far laser in general. Sounds good? Now, let's go into the details of that. And that's one of the pros and cons of tattooing. The pros of tattooing, that it's long lasting, it's permanent, right? The cons, that if you're not happy with the tattoo, it's long lasting. So you have to spend money on it to treat, to remove it, right? So that's one of the pros and cons at the same time, correct? So laser tattooing in general is, it target the ink itself.
Mm-hmm.
And that's why it's very important to know what's the color. And if this is a professional tattoo or it's an amateur tattoo, because they differ, right? Usually amateur tattoo are easily to remove. Professional tattoo are sometimes harder to remove than amateur tattoo. So typically the laser target the ink, which means the ink itself is a pigment, right? Let's say you have a tattoo which is black, green, brown, yellow, red. There are all types of colors, right? So for each color, there is a certain wavelength of the laser that this pigment, which we call chromophore, absorb the light or absorb the laser. And then when it absorbs the laser, this energy causes the ink particle to heat up and breaks into small fragments. And then when this happens, now the immune response kicks in. Remember when we talked about the immune response? So
Yes.
when this happens, the immune response kick in and then eliminate those pigments to the lymphatic drain. So it takes the pigments from the skin to the lymph nodes, right? So this is how the laser works. Again, you have to make sure that if you're going to go to someone to remove your tattoo, that this person has in his office a laser tattoo removal that can remove the color that you need. See what I mean? Because as I
Yes.
mentioned, different colors are different. And typically the black and dark green are easily removed than the lighter skin colors. Like the yellow, the red, these are sometimes harder to remove, and they need multiple sessions more than the black one, for instance. Like for instance, a black tattoo can be removed maybe in 3 to 5 sessions. Sometimes the red, yellow, and the white is the worst, by the way. The
Mm.
yellow, red, and these type of colors can take up to 15 sessions. So imagine how many sessions you're gonna do and how much money you're gonna spend. See what I mean? It's big. And typically between each session is about 3 months period, so that the pigment that you already targeted are washed off, and then you can target the new one, right?
Mhm.
So the laser works in this type of laser, the best laser for tattoo remover, we call it Q switched laser or quality switch laser. These are the best laser to treat tattoo removal. Now, these type of laser, they have a very short pulse duration. It's like nanosecond or picosecond. Now, going back to your question about IPL, that's why IPL is not a good modality for treatment for tattoos, because IPL is a light, right? IPL stands for like intensive pulsed light, right? That's the abbreviation for IPL. So light therapy does not work well with tattoo. It may improve it, but it's not going to be as good as the Q switched laser. Because again, the Q switched laser has a very high potential, like high energy in a very short duration, pulse duration. Again, it's like picosecond. Now, when this high energy hit the skin, it fragments the tattoo particle, and this is how you get rid of them. The light does not have this quality. So the light is not going to be as efficient as a Q
Mm-hmm.
switched laser. So if you have a tattoo and you go to a physician office, always ask if they have a Q switched or quality switched laser to
Mm-hmm.
remove your tattoo. And if the color of your tattoo matches the equipment that the physician has. Also, one more thing to keep in mind, every skin type is
Right.
different. So for instance, if someone is fair skinned, it's much easier to remove a tattoo, a dark tattoo on someone who's white, for instance,
Mm-hmm.
right? If
Right.
someone has dark skin and has a tattoo, it's very hard to remove the tattoo. And the reason why, because the laser cannot differentiate between the tattoo and the skin color. It targets all pigments,
Yeah.
right? So if you have someone who's dark and then you
Mhm.
have a tattoo next to it and then you hit it, you're going to induce depigmentation of the normal skin at the same time. So this will be a complication, not an advantage, right?
Yeah.
So what we do is there is a certain type of Q switched laser that we use for dark skin. The
Mm-hmm.
same for laser hair removal, for instance. If someone comes for laser hair removal and has dark skin, we have to use a very special type of laser
Mm-hmm.
to remove the hair. Otherwise, complication may happen. The same for tattoo. If someone has dark skin and we use the wrong type of laser, let's say two patients, one is skin type 1 and one is skin type 6. If we use the skin type 6, the same laser that I use for skin type 1, there
Mm-hmm.
will be huge amount of complications that's going to happen for skin type 6. So
Right.
again, the type of tattoo, professional, amateur, if the tattoo has more than one color or just a single color, what type of color in the tattoo, and what the skin type of the patient. All these play a factor in your decision to use a certain type of laser for these patients.
I understand. Oh my goodness. Thank you so much for an amazing information. There's a question in the comments saying, does MKTP also work well on lighter depigmented scars or chemical burns? If so, what percentage of success rates are there for something like that?
That's a very good question. So initially, this type of procedure
Mm-hmm.
was initially for treatment of vitiligo, right?
Mm-hmm.
But in my office, I tried them on patient who has depigmented scars, exactly like the question that you asked. And I had a specific patient in mind who had a depigmented, like white scars on her nose and on the forehead from a previous acne, and she had like white scars on the face. And I treated them with MKTP with huge success. The depigmentation completely gone. The laser itself improved the texture of the skin, and then the cell transplant of the melanocyte produced pigment in this area. So the texture improved as well as the pigment itself regained after the MKTP. Uh, to be honest, still we don't use it that much for scars. It's not
Mm-hmm.
a common practice to use this procedure for scars, but for specific cases that I did personally, I find it to be effective as well.
Got
And
it.
there is
Yes.
actually a case series that we're publishing at this point about that, not just
Mhm.
for scars, for other depigmented lesions as well.
Right. Well, as a medical touch, paramedical tattoo artist and camouflage specialist, I'm working on hypopigmentation scar is my favorite procedure to do because it's just giving me like 99% successful rate. of the
Mhm.
procedure. So anyone in the audience who have questions about camouflage tattooing on hypopigmented scar, feel free to send me the message. I'll be able to do some phone consultation with you. Um,
And
so,
just to
mhm,
also like comment on this, I think it's a great thing what you're offering.
mhm.
Because again, most of the dermatologists or offices that treat scars, we can improve the texture of the scar by using our laser. Remember when we talked about resurfacing laser like CO2 and erbium-YAG lasers, right?
Yes,
So
uh-huh.
these are resurfacing lasers. So we can improve the texture of the scar. We can make the scar flat.
Mm-hmm.
We can improve how the scar looks like and how it feels. But it's very hard to regain the pigment of the scar. So again, this is
Absolutely.
something that we can collaborate on. Like
Mhm.
again, medical tattooing can be a complementary to a dermatologist. So we can improve the texture, and then by doing the medical tattooing that you're just talking about, you can also improve the regaining of the pigment to the depigmented scar area.
Absolutely. Yeah, I do have to emphasize, just like, what Dr. Mahmoud just now mentioned to all of you today, you do need to go to a camouflage specialist who are professionally trained to know how to match the color. The color matching really comes from understanding the undertone of the skin, overtone, the biochromes of the skin, how does it affect undertone, how does it affect overtone, which I teach my students in my training. And understanding the undertone comes from creating the hue on the skin, because our skin is never one straight color. That's
Mhm.
where the realism color matching comes from. Also using a various technique of tattoo technique in order to layer the color and create more realistic color. So I wanted to emphasize on that. And Dr. Mahmoud, we will love to have you back to talk more about role of camouflage tattooing on post-surgical scars in the future. Would you join us again when you have some time?
Sure,
We'd
happy
love
to.
to invite you again.
Happy to. Thank you.
Yes, also, Dr. Mahmoud is a skin cancer surgeon, so we would like to cover the topic on skin cancer surgeries and some more information around skincare, surgery scars. And then if you guys have more any questions about these topics, feel free to send me a message. So we'll make a list of questions so we can cover in next Instagram Live with Dr. Mahmoud.
Thank you very much for having me. And again, thank you for Renee Gao for organizing this event. Thank you very much.
Renee, thank you so much, Dr. Mahmoud. I appreciate your time again. And we will see you soon again on another Instagram Live. Thank you so
Thank
much.
you. Have a good night.
Bye.